The legal age for consent in the UK, which is England, Scotland, Wales and Northern Ireland, is 16. However, sex is only legal if both partners want to have sex, are not being coerced and are ready for sex. If you are in a male-female relationship and are both ready to have sex, then you might also need to consider using contraception to prevent pregnancy. Contraception is something that stops you becoming pregnant. The only method of contraception that covers you for STIs is condoms. We talk about that in our other video. All contraception is free from local family planning, sexual health or GPs. Anyone can ask for contraception no matter how old you are. If you are under 16, a doctor, nurse or health worker can prescribe contraception to you, as long as we believe that you understand the information we're giving you and that you're ready to have sex. If you're worried at all about visiting a clinic, you might want to visit a specialist young people's clinic, such as Brooke. You can also buy condoms at any age. You can buy condoms from high street pharmacies and chemists like Boots or Superdrug, as well as larger supermarkets, petrol stations, pubs and vending machines in toilets. However, do be aware and check for the CE mark and the expiry date if you do get them from machines. For more information about male and female condoms, please watch our STI video. You can get free contraception, including condoms, from family planning or sexual health clinics and your local GP. All information that you give us is confidential, even if you are under 16. But it's important that we as healthcare professionals know that you understand the information you're being given and that you're not being pushed or coerced into anything. If we believe that you are at risk of harm, then we may need to speak to somebody else about you, but we would only ever do this with your consent. Emergency contraception can be used to prevent an unwanted pregnancy. If your contraception fails, you forget to take the pill, or the condom slips or splits, or you didn't use contraception at all. You need to act fast, as the sooner you take it, the more effective it works. There are two types of emergency contraception: the IUD, or the intrauterine device, or the pill, sometimes known as the morning after pill. There are two types of emergency pill: Levenel and Ella-1. Levenel can be taken up to 3 days or 72 hours after unprotected sex, but the sooner you take it, the more likely it is to work. If it is taken within 24 hours after sex, it reduces the risk of pregnancy by up to 95%. You can buy Levenel in pharmacies if you are over 16. You can also get it from your GP, local family planning clinic, and some pharmacies can give you Levenel for free, but it depends where you live and what your age is. Ella-1 can be taken up to 5 days after unprotected sex, but at the moment it is only available on prescription, so you'll have to get it from a family planning clinic or your GP. The IUD is sometimes called the coil. It is a small plastic T-shaped device with copper wire around it. It is inserted into the uterus or womb by a doctor or nurse. It can be fitted up to 5 days after unprotected sex. It is the most effective form of emergency contraception and works to prevent pregnancy for up to 10 years. So if you like it once it's been fitted, it can be left there as your usual method of contraception. The IUD is free and can be fitted at a family planning clinic and some GP practices. Even if you think you might be too late to access emergency contraception, you should still visit a sexual health or family planning clinic or your local GP. Also, if you've had unprotected sex, you may be at risk of catching an STI, so you should go and get a test. More information is available in our STI video. We are going to look at regular methods of contraception in our next video.